A monovalent chimpanzee adenovirus vaccine preliminary report. Catholic University Faculty of Medicine. Here we have the links of Facebook, Twitter, and Outlook where you can find more information. Now we have Ebola virus. Ebola virus has been found in African monkeys, chimps, and other non-human primates. A milder strain of Ebola has been discovered in monkeys and pigs in the Philippines. Marburg virus has been found in monkeys, chimps, and fruit bats in Africa. Now we're going to see a video.
The outbreak began in southeastern Guinea in March. Since then, it has spread to neighboring Sierra Leone and Liberia, with 814 confirmed cases across 3 countries. The Ebola virus is transmitted through bodily fluids, via oral and nasal exposure, and through the conjunctiva. The virus infects and replicates in immune cells, which further disseminate the virus. Lymphocyte depletion and necrosis are observed in the spleen, thymus, and liver. Intensified immune response leads to dysregulated coagulation, which causes bleeding and hemorrhaging in the gastrointestinal tract. Compromised vascular and endothelial cells also cause blood vessel leakage, leading to hypotension. Dysregulated host immune response, coagulation abnormalities, and an impaired vascular system lead to shock and systemic organ failure. Doctors are at high risk of exposure to the virus. They must apply additional infection control precautions, including wearing personal protective equipment such as gowns, masks, gloves, and goggles, as well as ensuring complete equipment sterilization. Ebola patients must be isolated and attended by medical staff who have been trained in infection control measures.
As we can see, here explain how Ebola virus can be spread. So we're going to continue now with research aims. The CHAD3 EVOC vaccine uses a chimpanzee adenovirus to stimulate an immune response in the vaccinated volunteer against the glycoprotein from the Zaire strain of Ebola, which is responsible for the current outbreak. Adenoviruses from chimpanzees has been used successfully to produce protective immunity against malaria and are safe for use in humans. Now we're going to see another video.
In the labs of the New Iberia Research Center, scientists are testing the effectiveness of the Ebola vaccine that could protect endangered wild apes. Scientists are conducting a trial with an oral vaccine that will be ingested by chimpanzees and gorillas. Dr. Peter Walsh is president of the nonprofit Apes Incorporated. He says Ebola is one of the leading killers of chimps and gorillas in the wild.
Based on survey data, areas that have been impacted, we think probably on the order of a quarter to a third of the gorillas in the world died in the last 20 to 30 years from Ebola. On chimps, our estimates are not quite as good, but a very large number of chimpanzees, probably in the thousands to tens of thousands.
While we're doing the study, we will be able to monitor the chimpanzees very carefully. We'll be able to assess whether there's any ill effects from this vaccine.
Food intake, body weight, and body functions will be monitored. Blood samples from the chimps will be taken at recurring time points to monitor how they're tolerating the vaccine.
We're bringing all of our expertise to this trial to evaluate the safety of this vaccine for administration to chimps in the wild. We're able to control every aspect of this study except the one variable of the vaccine and the immune response to that vaccine.
The study is being coordinated with Dr. Matthias Schnell, director of the Jefferson Vaccine Center at Thomas Jefferson University. He helped develop the vaccine. At NIRC, some chimpanzees are being inoculated by intramuscular injection. Others are being tested with doses of the vaccine that are placed inside their cheeks and under their tongues while they are sedated. Vaccines haven't been used to combat outbreaks of diseases in chimps and gorillas in the wild because of the conditions. The goal is to administer the vaccine at bait stations by placing it in fruit or other foods.
Right now, we're doing this vaccine trial now. If it's successful, fingers crossed, then we'll go out and we'll go in the coming year, probably early next year, go out and start trialing it in Africa.
I'm Chris Welty reporting for the University of Louisiana at Lafayette.
So as we can see, we're going to continue with exposition. Results. A studying monkey using the vaccine resulted in 100% protection against the Ebola virus drove production of antibody and T-cell response. Now we're going to see a video.
Ebola, almost like no other word, no other disease, can conjure up fear. However, in fact, to contract Ebola, you need to touch someone who actually is showing the symptoms, and you need to touch fluids of theirs, saliva, blood, whatever, and then transmit where the virus is still alive, and then transmit that to yourself somehow. So it's very difficult. If you know someone has Ebola, or if someone looks sick, you're not going to go touch them. And the main thing, consequently, then, is really proper facilities. And again, the proper facilities have been what's lacking in West Africa. Proper facilities don't lack in Spain or in the United States, where these patients have been taken. You get them into isolation. You have the proper protective equipment for the medical personnel dealing with them. There is an extremely low risk of anything happening there. The challenge for us is West Africa.
Continue with what are the symptoms of Ebola. Early Ebola can feel like the flu or other illness. Symptoms show up 2 to 21 days after infection and usually include high fever, headache, joint and muscle ache, sore throat, weakness, stomach pain, lack of appetite. As the disease gets worse, it causes bleeding inside the body, as well as from eyes, ears, and nose. Some people will vomit or cough up blood, have bloody diarrhea, and get a rash. How is Ebola treated? There is no cure for Ebola, though researchers are working on it. Treatment includes an experimental serum that destroys infected cells. Doctors manage the symptoms of Ebola with fluids and electrolytes, oxygen, blood pressure medication, blood transfusions, treatment for other infections. And finally, we're going to see the video about the treatment of Ebola virus.
And when it comes to how many American hospitals are really prepared to accept Ebola patients, the answer is really only a handful. You know, before this case, we had Emory here in Atlanta, the Nebraska Medical Center. They accepted Ebola patients, but they knew they were coming in advance. They had a chance to prepare, prep the staff. This Texas case, this is the first walk-in, Anderson, of an Ebola patient. hospital clearly stumbled, and that, say infectious disease experts, really needs to change.
We have a lot of hospitals that aren't prepared and really probably don't even want patients. And so what we've seen that hospitals now are downloading paper-based guidance plans from the internet, and they're now working out how to do the management, how to do the implementation, and how to make these things happen to ensure that if they do unfortunately get an Ebola patient, everyone in the hospital is going to be safe.
Wow, they're downloading stuff from the internet. That's not exactly comforting. Are there guidelines at those hospitals and other hospitals about medical waste generated by treating Ebola patients?
You know, that's a good question, and it speaks to what Elizabeth Cohen was talking about with that vomit in an ambulance. There's a lot of waste. It's got to be gotten rid of safely. You know, at Emory, they had the two patients here. A doctor told a staff meeting at the peak, when they were treating those two patients, they were generating up to 40 bags of medical waste a day. And what then? You know, every hospital has procedures, Anderson. Practically every hospital in the country hires outside contractors to take care of the trash. In the case of Ebola, waste, however, the rules are still being sorted out. A Washington-based trade group that represents these waste haulers told us basically that current federal regulations effectively restrict transportation of this material.
So are you willing to take away what is a level 4 category A disease and disperse and get rid of that waste safely? And we believe that's not there at the moment because we haven't tested it. We haven't visited the hospitals, we haven't done risk assessments, and we haven't done on-site visits and evaluated their capabilities and their competencies and their capacity.
Look, the waste is more of an administrative problem, really, but you've got to, you know what you have to do to prepare for this? You've got to drill. These hospital staffs need to get their act together, Anderson. They got to deal with the very real possibility that tomorrow, one guy could walk in, say, I've been to Liberia and have a fever. Right now, this stumble in Texas, as bad as it was, may have led to more people being exposed. It could be a great wake-up call for every hospital out there that's basically been putting off these kind of drills and are now downloading papers on how to handle Ebola patients.
And we finish. So, to conclude, doesn't exist a specific vaccine nowadays for Ebola virus. That doctors are working on it, but nowadays doesn't exist. And how we can prevent, here in the videos we can learn, so applying our daily life. And thank you.